Assalamu alaikum. I'm Dr. Ijaz Naqvi on behalf of the SABA Islamic Center. Welcome to the annual Ramadan Health Panel. And usually we have these in person, but due to the pandemic, this year we are having this virtual get together. So we have a distinguished panel. In previous years, we have done a number of different topics, and we have covered pediatric topics and other health-related topics, and we have done a lot of in-person screenings like blood pressure checks and sugar checks, etc. This year we have selected a couple of themes that are very relevant to the times we are living in. One is the pandemic, of course, and how pandemic has affected us physically and emotionally. And also how some of these questions that are specifically and directly related to COVID-19 itself, the vaccines, should I get it, when should I get it, side effects, etc., etc. So we have three distinguished healthcare providers. Dr. Farnaz is an epidemiologist, Dr. Lubna Hasnain is a pediatrician, and Dr. Raza Noorani is a psychiatrist. One of the reasons we picked these distinguished healthcare providers is because we wanted to cover some of the areas that are really pertinent to the times. You may have heard about the tragedy in Texas, where someone committed suicide and also killed the family members, 6 of them. They were Muslims. And then they were reportedly, quote unquote, practicing Muslims. So to see that kind of issue that's certainly related to mental health was eye-opening for us. And soon thereafter, there was a suicide by a teenager in New Jersey, which a lot of people thought was a quote unquote a copycat, even after hearing about the Texas tragedy. So we felt that we need to focus on the community mental health in general, but specifically how it relates to the pandemic and then the seclusion, the social isolation that we are experiencing. So without further ado, before we actually go into the short speeches, let me tell you that our program is about an hour long. There'll be short speeches by these three panelists, about 6 to 8 minutes long. After that, we will have a question answer session. So please stay till the end. Start to write down your questions, and there will be you can write your questions down on YouTube channel that you're watching right now. So my first speaker will be Dr. Farnaz, and let me introduce you to her. She is an epidemiologist at UC Berkeley. She has a master's in public health, and also she also has. Let me actually go back here. I'm picking up her bio in a second. I'm playing with my phone here. Give me a second. So she has medical doctorate degree from Tehran with master's in public health, and her PhD was in epidemiology. Sorry, Dr. Farnaz, for that blurb there. She has over 15 years of research in academia and life sciences industry. So without further ado, Dr. Farnaz, please go ahead.
Thank you so much, Dr. Ijaz. Salamun alaikum, everybody. Ramadan Kareem and good evening. I am going to start my short talk and the panel with a few topics related to COVID pandemic and vaccination. I have a few slides that I can present here. Do we have the slides on the screen? Okay, great, thank you. So I just want to highlight a few common questions, and then obviously I'm open to question and answers in the second half of the panel. But I want to highlight these few topics. The first thing is about access and eligibility to COVID vaccine. Here are some websites and some locations that you can find places across the U.S. and in California specifically that you can go online and you can schedule your appointment for vaccination for COVID. So far, we know that there are 3 vaccines that are authorized and are accessible in the US. 2 of them are currently active. One of them is on hold, and we can discuss this further later in the Q&A session. But the ones that are available, you can either use the vaccine finder or the site that is related to the Federal Retail Pharmacy Program, or the California Public Health website, My Turn. And based on your location, you can find the places that are closer to you, and you can schedule your appointment for the vaccine. There is no recommendation of one vaccine brand over the other vaccine. So out of the 2 vaccine brands that are right now administered, both of them are recommended the same way. In terms of the efficacy and side effects, there is there's not a huge difference between the different brands. And what I want to highlight here and emphasize is that even if you are fully vaccinated, you still need to keep your social distancing, use your mask, avoid crowds, and keep your hand hygienes and hygiene measures. That said, I would like to talk about a little bit about some myths and facts about the vaccination. These are some common questions that are raised, and I guess that it would be questions that the audience in our community might have in their mind. So first of all, you will not get sick with COVID-19 when you are vaccinated with any of these vaccines that are authorized at this point. Your test with COVID-19 will not turn positive after the vaccination. And the vaccine is not going to change or interact with your genomes or your genetic material, and neither of them. There are 2 different type of vaccines that right now are used, but none of them are going to interact with your genome material. Some facts is that the vaccination is worked by boosting your immune system, teaching your immune system that how to recognize and fight against the virus if you are exposed to the virus. So kind of training your immune system to be ready and to fight the virus. So the vaccines are going to prevent death from the COVID infection in case you get infected, and hospitalization and severe cases. These are the facts, and this is something that has been established in clinical trial by testing and by administering that vaccine to thousands and thousands of people. Another fact is that even if you have been tested positive with COVID in the last year, have been infected with the virus, still you need to get the vaccine, because the immunity from the natural immunity after you get sick is not going to last long. At most 3 months. It's not very well known, but at most 3 months. So if you have had a positive test more than 3 months ago, you still need to get your vaccine, because the immunity is much more stronger and it's much more stable. And if you are nursing or you are planning to have to become pregnant, still it's safe to get vaccinated. One last topic that I want to mention here is about traveling during the pandemic. First of all, we are still in the pandemic, and we haven't reached that level of vaccination across the globe that is desired to stop the pandemic. And so there is still a high threat of getting infected, especially with the new variants. The vaccine are effective against the existing variants and some of the new variants, but still the virus is changing and evolving. So in other parts of the world, there might be some variants circulating that you are not fully immune, or the efficacy that you are assuming that you are having, the protection that you assuming you're having because you are fully vaccinated, is not going to protect you against the new variants that might be emerging in other parts of the world, not in the US. And the second point is that to research the requirements at your destination. You might need to be on quarantine if you travel internationally. There might be requirement to be tested by some airlines or some countries. CDC has removed the requirement for testing for domestic travel if you are fully vaccinated, but this is just for domestic travel, not for international. So do your research before you make any plans. Air travel is considered one of the safe modes of transportation because of the filtration and the air exchange. But consider if you're traveling, you're sitting in the plane for a long time, but that's not the only place that you're interacting with other people. In the airport, in the terminals, and in crowded locations, like the shrines, if you're going for ziyarah, that might be some places that you might get exposed to people who are coming from all around the world. And then the other point is that you're vaccinated, you are protected against severe disease and death if you get infected or you get the virus, but you still can transmit the virus. You can have the virus in your system and not get sick because you're vaccinated or don't show any symptoms, but you can transmit it to other people around you, the people who are accompanying you in the travel, your loved one in your household. So you have to be careful and conscious about that as well. And the last point is that consider that if you're traveling to areas where the vaccination level is low and the healthcare system is overwhelmed and saturated because of the high number of cases with COVID, then if anything happens to you, God forbid, you have a broken leg or some chronic illness you have that might exacerbate that, then there is not enough care that the necessary care that you need, you might not receive during travel. You can see the pictures on the right, lower right. I want to end my talk with this analogy that a professor at Emory University made about vaccine and mask and social distancing. If you are walking into a rainstorm, that's where we are. We are in a rainstorm of the pandemic. You put on your rain jacket, which is the vaccine, but you still need to carry your umbrella and have your boots, which are the mask and the social distancing. So keep that in mind. And with that, I will end my presentation and I ask the other panelists to continue. Thank you.
Piece of information, and I'm sure folks have a lot of questions, so please hang on to your questions until the end of the last presentation. Our next presenter is Dr. Ghulam Raza Nurani. He is a former adjunct professor of anatomy and psychiatry at Touro University in California. He is also a former faculty for University of California, Davis School of Medicine. And he's making me jealous. And he stated that he has retired now from medical practice after being in medicine, the medical field for 22 years. So without further ado, Dr. Ghulam Raza Nurani, please go ahead.
Hello, Assalamu alaikum. Today, I'm going to be talking about effects of COVID-19 pandemic on mental health. And I'm going to be showing you some slides. I'm trying to move to the next slide and it's not moving. Okay. I hope that I changed the slide over here. I don't know whether it showed up or not.
Yes, it is. So please go ahead.
Okay, so 74% of all deaths in the United States occur as a result of 10 main causes. And over the past 6 years, the main causes of the death in the United States have remained fairly constant, except for the last year when COVID-19 deaths jumped to number 3 spot out of nowhere, and pushed the suicide deaths from number 10 to number 11. Here is a comparison of the top 10 causes of death in USA. In 2019, if you can see, those which are in the blue on both sides, they remain the same. Number 3 cause of death in United States was accidents or unintentional injuries. However, in 2020, it was replaced by COVID-19 pandemic, and there were 345,323 deaths in 2020, which was the third highest cause of death in the United States. And in 2019, suicide or intentional self-harm was the 10th leading cause of death. And when COVID jumped into number 3, it dropped the suicide rate from number 10 to number 11. So that's one positive thing which happened, that the suicide rate went down and it dropped by 2,677 in USA. Here is a graph of top 10 causes of death in 2020. Number 1 is heart disease. Number 2 is cancer. 3 is COVID-19. Number 4 is accidents or unintentional injuries. Then stroke, then lower respiratory disease, then Alzheimer's disease and diabetes, influenza, and kidney disease. What you don't see in here is number 11, which is suicide, which dropped to number 11 in 2020. Thank goodness. However, the mortality decreased, but the morbidity of the psychiatric illness increased. Here's another graph which shows the top 10 causes of death from 2015 to 2020. Here you can see on the third line that COVID was not present until last year, and it jumped all the way to number 3 after heart disease and cancer. And suicide, which was number 10 during the last 5 years, it dropped to number 11. So what was the impact of COVID-19 on our lives around the globe? It changed multiple things. Some people lost their jobs. Some people lost their income. Some students, or most of the students, they could not go to school and they stayed at home and did homeschooling. Social interaction was lost, and most of us were in isolation. A lot of us could not travel, and pandemic has impacted mental health, particularly mood and anxiety disorders. I'm going to show you a slide which shows the anxiety and depression in 2019. What was the incidence of anxiety in 2019, and how much was the anxiety and depression in May of 2020? So this column, the second column is for 2019, and this second column is for 2020. So you see this anxiety in 2019, pre-pandemic, was 8% about, and in May of 2020, it jumped to about 31%, which is 4 times the incidence which we had a year ago. Depression rate was about 6%, and it jumped to about 24%. Depression also jumped to about 4 times the one which we had in 2019. And those who had both the symptoms, anxiety and depression, it went to 11%. It was in 11% in 2019. And during pandemic, it went up to all the way to 36%. So it shows you how much anxiety and depression and trauma and stress-related disorders were increased during the pandemic. And when there's high anxiety and high depression, what happens it increases the risk factors for suicide. And following are the risk factors for suicide: psychiatric illness, physical illness, chronic pain, poor communication in the family, poor impulse control, history of past suicide attempts. So if you can see that I have put all of these risk factors, which begin with P over here, 1, 2, 3, 4, 5, and 6 Ps. I put them all together, so it is easier to remember. The risk factors are not necessarily in this order. History of suicide in the family or in the community also increases the risk. Like Dr. Ijaz was mentioning, if there was a suicide, murder-suicide in Texas, and then same thing happened in New Jersey. So that is an example of when you see or hear about violence to self or others, copycat symptoms or syndromes may occur in the community. That's why we thought it was important to educate the community about the risk factors for suicide. Another risk factor is history of psychiatric illness in the family, like anxiety disorder, depressive disorder, psychosis, which includes hearing voices, paranoia, disorder of thought process. Also, other risk factors for the suicide is losses like job. So many people, like about 42 million people, lost their job during the pandemic, and some people lost their businesses. Imagine if you don't have a check coming in for a few months, you cannot pay for your houses, you cannot pay for your kids' tuition, you cannot support your family. It's just a very helpless feeling a man can have, or a woman can have if she's the breadwinner of the family. Also, lack of social support or isolation is a very big risk factor. These are suicide risk factors continued. Also, if there's a history of abuse, sexual abuse, if somebody has been sexually abused, emotionally abused, or physically abused during their childhood or adolescence, it puts them at a higher risk for suicide. If people abuse alcohol, it puts them at higher risk for suicide. Substance abuse also puts us at a higher risk for suicide. History of violence. Somebody who has a history of violence is more likely to commit suicide than one who has not. Recklessness. Like somebody who drives recklessly is more likely to hurt. Somebody who makes reckless decisions is more likely to hurt himself or herself. Having guns or firearms in the home is also a very big risk factor. If possible, it should be avoided. Being exposed to other suicidal behaviors, such as that of the family members, peers, or celebrities, just like Dr. Ijaz mentioned, Texas and New Jersey cases, copycat cases. Bullying among peers can also subject teen and adolescents to suicide. That reminds me, Dr. Lubna Hasnain, she is going to talk about teen suicide after I finish. So hang on and she will go over it. What are the warning signs for suicide? People who commit suicide, they talk about it. They talk about suicide or death. They increase their substance abuse. They feel hopeless. They feel like they're trapped and they cannot get out of the condition in which they are in. Their anxiety and agitation is increased. They are more angry. They snap easily. They get upset with you easily. They drive recklessly, or they make reckless decisions without worrying about the consequences. Social withdrawal is very big. Somebody who is isolated is more likely to commit suicide than somebody who has a social support. And they have sudden mood or attitude changes, and they give away their positions, and they write farewell letters, and they also write their will and make changes to the will. And sometimes they have psychosis, and psychosis is, what is it? Like paranoia, hallucinations, and disorder of thought, and they're not in touch with reality. Following are the bad choices. So I created a mnemonic for you. The spelling of the choice is not as you would like it to be, but it will help you remember. If I don't tell you, Dr. Google can tell you very easily. But these, I'm putting the slide over here so that you know that these are bad choices. The bad choice DJ. This is an acronym or a mnemonic for it. Cutting is a bad choice. Hanging, overdose on drugs, inserting objects in the body, shooting, strangulation, suffocation, drowning and jumping. These are the methods which are used to do self-harm. And I put it bad choice DJ to help you remember that these are not a good choice. And there are certain suicide myths and facts. Myth: people who continually talk about and threaten suicide won't do it. It is not true. People usually talk about suicide before they commit suicide. And always think about referring someone who is talking about or even joking about or wanting to die by suicide. It is not something which can be taken lightly. When you're at the airport, you do not use a word which is called bomb, B-O-M-B, bomb. In psychiatry, we call it the S bomb, the suicide bomb. When you're having stress or you're a psych patient, if you are not suicidal, you should not drop the S or the suicide bomb. So it's called S bomb, which I created to help my students remember it. Another myth is people who harm themselves are just trying to get attention or manipulate others and are not really suicidal. It's not true. Individuals who do self-harm are much more likely to attempt or complete suicide. And more females attempt suicide and more males complete suicide. So if you find somebody who is suicidal, what do you do? This is a slide which you can use. There's a National Suicide Prevention Hotline, and so, phone number is 1-800-273-TALK. Crisis text line, you text hello to 741-741, and there's this website which you can go to. And also, those who complete suicide, what do? They don't communicate what they want to do. They're going to do. They hide it from others, so they don't get any help. If you communicate that you feel like you are in danger of hurting yourself, you let your family or friends or loved one know. They can provide you support and care. And if somebody is in imminent danger of hurting himself or herself, and they're talking about suicide, one thing which you should do is to not leave them alone and tell them that you're there to help them and we'll get through this together. Don't let that person feel like he or she is alone on an island. You be there with them, communicate with them, and provide them the help which they need, which may be an involuntary hospitalization because they're a danger to themselves. And I was asked to provide some of the resources in the community. This slide, you can take a screenshot and where you live. This is one comprehensive psychiatric services, which has psychiatric offices all over the Bay Area. And I know that some of these clinics, or rather most of these clinics, to have some desi doctors who understand the cultural aspect of our psychiatric illness. With that, I will stop. And if you have any questions, I will be available after the presentation ends, and I'm also available via the email, and SABA Center can provide you with my email address. Thank you very much. Khuda Hafiz. Assalamu alaikum.
And without further ado, we will go to our next presenter. But this is also an opportunity to remind everyone, you can start to pose your questions now. You don't have to wait until the end. Go ahead and start to pose your questions. So our next presenter is last but not the least, Dr. Lubna Shah Hasnain. She is a pediatrician at Kaiser Permanente in Walnut Creek. Her special interests include pediatric obesity and autism and asthma. She is also the clerkship director for our Kaiser Drexel University School of Medicine student program. And she is a past president of the Alameda County Medical Association, ACMA, and also currently she is the chair of Governors Council in California Medical Association, CMA. Without further ado, Dr. Lubna Hasnain, go ahead, please.
Assalamu alaikum. I'm privileged to be here. I'm sorry, I'm having some technical difficulties, so I'm actually joining through my telephone. And as a result, I'll be speaking a lot, and you guys will see no slides. So just keep your ears very open. So as I said, I'm privileged to be here, and I'll continue with the same theme and will elaborate on how the pandemic is affecting the mental and physical health of children. So signs of stress and mental health challenges are not the same for every child or teen, but there are some common symptoms. So I'm going to start with the older children or adolescents. During COVID or any types of stress, what you will see in older or adolescents or young adults would be changes in mood, frequent conflicts with family, disinterest in Zoom school, and falling academics. Weight gain, of course, because of sedentary habits and increased screen time. So the question is, and this was going to be my second slide, how do you deal with teen attitude? Well, guys, the job is not over, because even though the child is tall enough to look at you, you are still the parent. Discipline is even more important given the risk of teen safety, health, and future successes. So whatever tools you gained through rearing them from childhood to adulthood, you're going to use the same tools. So what are those tools? Number one, praise. Praise is a powerful tool. The teen still wants your affection and your approval. Ignore. Active ignoring remains a useful tactic more than ever. He or she wants to be heard, but for you to listen to them, they will have to speak respectfully. And believe me, this works. Time out can also evolve in teen years. Suggest a 15 to 20 minute time to calm down so that the two of you can resume a more constructive conversations. And last but not the least is consequences. Logical consequences are useful as well. The natural consequence of not studying is a lousy grade. And the logical consequence of a lousy grade is taking away that video game till the next grading period. You also have the option of adding household responsibilities. And sometimes what actually works is asking the teen him or herself to propose a consequence after he or she breaks a rule in the house. You may find that their sense of justice may be harsher than yours. And now I'm going to talk about my third slide. So just imagine you're seeing slide number 3. And this is about actual mental health red flags that I think, Dr. Noorani already spoke about. And there are things like, excess sleeping, which can either indicate depression or substance abuse, loss of self-esteem, weight loss of appetite, excess weight gain, loss of interest in favorite pastimes, excess anger or aggressiveness, and drug use issues. So here are some tips for parents. Um, First of all, you have to keep your communications open and honest. Reach out to your teen. Knock on the door, park yourself on their bed, and say, "You seem sad. Would you like to talk about it? Maybe I can help." Share your own feelings. Talk to them about your experiences and fears. Let them know that they're not alone, nor are their anxieties unique. Do not react with shock if they say or write, "I want to die," or "I do not care anymore." Do non judgmental listening. To see a child so troubled is hard for any parent. Nevertheless, in a calm voice, you might say, "I see, you must be really hurting inside." Understand that mental health disorders are treatable. Encourage socialization in your bubble. I understand that we are all in our little bubbles, but as much as you can. But if the child uh, keeps saying no, then do not insist. But try as much as possible to keep the socialization doors open. Recommend exercise. Now, physical exercise actually can put a brake on mild to moderate depression. And the reason is that exercise causes our brain to produce a substance called endorphin. And endorphins actually improve mood. In addition, endorphins also decrease cortisol levels, which is another hormone in our circulation. And cortisol is a hormone that has been linked to depression. Last but not the least, firearm access. If you have firearms at home, please remove them. Suicide by firearms in America have always been high. So access to firearms should be out of the question. But if you have firearms, please keep them under lock and key. And again, seek professional help if your child is really troubled this way. Another question to ask when you start seeing your adolescent behaving in a way that you're not used to him or her behaving, you have to ask the question, is your child vulnerable to substance abuse? 1 in 4 illicit drug users between the ages of 12, mind you, and 17 develop dependency. It is unclear why one teenager can flirt with alcohol and pot and then break off from this activity cleanly, while others can head into a lifelong addiction. Hereditary actually plays a part in susceptibility to drug addiction. For example, sons of alcoholics tend to have more addiction. They are 4 to 5 times more likely to be alcoholics. So inform your child about such a history if you have this history, and this can serve as a deterrent. So in actuality, that can be a positive because you can say this has happened in our family and make sure that you don't do drugs. And the other thing you have to understand is that you have to be well informed about the drugs that are out there or the happenings that are happening, out there. So the U.S. Department of Justice or of Education, I'm sorry, recommends that the minimum that a parent should know before broaching the subject of drug use to your child is they should know about the different types of drugs and street names, what each drug and any association or the paraphernalia that they use for drugs looks like, the physical and behavior signs of drug use, and of course, how to get help for your child if you think they have drug use. And another thing that I wanted to bring up was that besides marijuana, Vicodin and Xanax are very highly used by adolescents. These are prescription drugs, so one needs to be aware of that. According to AAP, the prescription drug misuse is second only to marijuana and alcohol. So that's enough said about drug use. And one other thing I wanted to tell you was that things like decongestants and cough suppressants, these are also used by adolescents for basically for recreational use. I will now switch gears and talk about younger children. So, what are the signs of mental stress, especially in a pandemic, in younger kids? So, infants, toddlers, and young children, they can show increased problems with fussiness, irritability, trouble falling asleep, stomach upsets, diarrhea or constipation, separation anxiety, being more clingy to their mom or dad, temper tantrums. 3 and 4 year olds who might be potty trained may start bedwetting, and this could be a sign of stress from COVID. And of course, if they're doing pretend play, you may see them doing more pretend play with death themes, aggression, conflict, and things like that. So so that's as far as the children are concerned. Just be aware of it, and this is and hopefully this will be temporary, and with good parenting you can overcome these sort of regressions in milestones that you see in infants and toddlers. What I also wanted to let you know is, because of the pandemic, of course, you guys, young parents are seeing less of their pediatricians, and as a result, immunization rates are decreasing. And if, God forbid, there is some issue with development, a lot of times those things get missed. And as a result, we are losing precious times for early intervention, which is so important to be done before 2 years of age. So as a parting remark, I'm going to tell you a couple of pearls for your 9-month-olds, your 12-month-olds, and your 18-month-olds. So for your 9-month-old, make sure that the child, if they're not, then you need to seek medical help. They should be either starting to crawl or should be crawling. They should be cruising. They should be playing peekaboo. All right. So those are the things for a 9-month-old. For a 12-month-old, they should be gesturing, if not pointing. They should be responding to their name, and they should be taking, basically cruising. It's not necessary that all 12-month-olds should start taking a step or two, but they should be standing up. And at 18 months, they definitely should be pointing and doing joint attention. Joint attention is, so for example, if you show a child something interesting, then they should look at it. That's called joint attention. And then, of course, saying anywhere between 5 to 10 words. I think I'm going to stop at that, and then we'll open up for questions. And I did want to tell you again, I don't have, this would have been a slide, and I wanted to refer you guys to a website. It's www.healthychildren.org. And it has a lot of pearls about parenting. It's through the American Academy of Pediatrics. Thank you so much.
Okay, well, thank you, Dr. Lubna Hasnan. That was really very, very helpful. And I would like to thank all three of you, Dr. Farnaz, Dr. Noorani, and Dr. Lubna, once again, for providing very useful information. We do have some questions, and I'm going to start with the questions around the COVID, and more specifically about the COVID vaccination. As I think we have all found out that Johnson & Johnson has been withdrawn, at least temporarily, because of the development of clots in 6 women. So the question is, if I have received Janssen or Johnson & Johnson vaccine, what type of symptoms should I monitor for? And if I had vaccine about a month ago, am I home free now if I don't have the symptoms? So Dr. Farnaz, if you could address that question, please.
Sure. Thank you, Dr. Rejaz. Yeah, as it was mentioned, there were very, very few and rare side effects from J&J Johnson & Johnson vaccination in the US, and it's been paused as of last week. These are blood clots or thinning of the blood in women only so far. The 6 patients who had shown those symptoms are women. And what you have to look for are within 3 weeks of your administration of your vaccine, you need to look for some signs and symptoms of abnormal blood clots in your body, which could be severe headache, severe abdominal pain, pain in your legs, or some neurological symptoms. And if you notice any, or some back pain maybe, If you notice any unusual symptoms, any of these symptoms, you should consult immediately with your healthcare provider and look for it. But it's within the first few weeks after vaccine administration. So if it's been 1 month from your vaccine injection and you didn't have any of these symptoms, as I said, it's still very rare, and the risk is much, much lower, 10 or 100 times lower than side effects of some of the very common medications that are used very commonly among people, and it's been used for many, many years. So the risk is very, very low. No need to be worried. This is out of abundance of precautions that and FDA have paused it. If it was not an emergency situation or a pandemic like this, it wouldn't even cause a lot of attention.
So there was a second part B of the question was, if I had received the vaccine a month ago, am I home free or should I still worry about it?
I would say if there is any risk, it would happen within the first 3 weeks, and that's what CDC is recommending.
Okay, thank you. And I would also like to remind our viewers is that all 6 cases that were reported in literature, they were women, all 6 of them, and they all had what we call cerebral venous sinus thrombosis, meaning the sinuses that are the veins that are like sinuses in the brain. That's where the clots happen, and the symptoms are severe sudden headache, nausea, vomiting, and some changes in mental status. And if you do have the symptoms, I think the recommendation is to immediately call the emergency, because this is a true medical emergency if that happens. All right, so thank you for addressing these 2 questions. My next question is to Dr. Lubna Hasnain. And once again, it is related indirectly to the COVID pandemic. So so the question is, if I have a 2 or 3 years old and haven't had a medical checkup because we didn't want to take them to the pediatrician because of the risk of acquiring the virus, is it safe now to take our kids for well checkups?
It's absolutely safe, and especially now that all our medical personnel are vaccinated, as long as you are taking the proper precautions, such as has been alluded to already, masking and good hand sanitization. It's super important that you bring in your children for their vaccinations and their periodic well checks. Thanks.
Great. So next question is for Dr. Raza Noorani. The question then is, you mentioned a lot of the symptoms of or the red flags for suicide. But if you have somebody in the family or the community that is showing some signs, what is the first thing that you can do at home to address that? And how do you know, how do I know as a layperson when to call for emergency?
Okay, so there are 2 very important things which you can do. Number 1 thing is you communicate with that person. Ask them how they're feeling, what they're feeling. If they're feeling suicidal, what do they want to do? Do they have a plan? Do they want to act on it? Is the danger imminent or not? Provide them support. Tell them that you are there for them. And if the danger is imminent, then the person needs to be hospitalized immediately. If they just have thoughts, a lot of people have chronic thoughts, then you can talk to them, provide support to them, take them to psychiatrists, give them medication of whatever is causing those suicidal thoughts, and see if those causes can be alleviated. But 2 things I would say: communicate with the person and provide support, and don't leave them on the island.
So you mentioned, Dr. Noorani, if the danger is imminent. What do you mean by that? How do I know if the danger is imminent if I'm not a psychiatrist?
Like suppose somebody at home says, I want to kill myself. A lot of people say, I want to do that. But you ask them, what do you want to do? I want to hang myself. Do you? And some people say that I will kill myself if this, and this does not happen. They're conditionally suicidal. And if there's no conditional, no strings attached to it, Or if they say that, yes, I want to do it, and somebody says, I want to shoot myself, and there's a gun in the house, and that gun should be removed immediately. That person should be assessed immediately, should call 911 or bring them to emergency room and hospitalize them. And at that time, whether they're voluntary or voluntary does not matter. They need to be in a safe environment, which you cannot provide at home.
And is there a suicide number or hotline that you like to share? I mean, I don't mean to put you on the spot, but if you want to think about it and put it in the chat box, then we can display it again.
Oh yes, I did it. My next to last slide, I put it in there.
Okay, well, thank you. So Mike, the next question is back to Dr. Farnaz, is that, I had the vaccine from Pfizer and I'm fully vaccinated. Why should I still put the face mask on or observe social distancing, etc.?
Yeah, that's a very good question. So there are two major issues that we need to consider here. First of all, vaccination for sure will prevent mortality and severe disease and hospitalization, and these vaccines are highly effective against these outcomes. But one outcome that has not been fully investigated is transmission and being contagious with the virus. They're still investigating that. So we are not really sure that a person who is fully vaccinated is not contagious if they're exposed to the virus. Let's say you are fully vaccinated and you go to a crowded place and you get exposed to the virus, you get the virus in your system and you can carry it to your household or to your loved one. And you go to your grandparents or your parents and you meet somebody who's susceptible to the illness and are not vaccinated, you can carry and transfer that virus to them. So that's the first thing, that you still need to keep your guards and you still need to be cautious. And the second thing are these breakthrough infections that are still happening. And as I said, the vaccine have been started to be developed last summer when the variants that were circulating in the community were different from what are there. These viruses tend to change as they evolve because they want to spread more and more. And as they are replicating and increasing, their genomic might change. And so they are slightly different from the previous version of the vaccine. So the new variants that are emerging, and they started in some other countries, and in the US, in California, we are seeing some of them, like the British variant, that is the UK variant. These are in the clinical trials, they have been showed that they have been effective against the virus, the vaccine, have been effective against the UK variant, but the other variants that are emerging have not been fully tested. So we don't want to put our guards down because we are vaccinated and think that there is no other risk outside, because what if there is another variant going on and we are not, our vaccine is not highly effective as we were assuming that is going to work. So we don't want to be one of those breakthrough cases. So as I said, this is an evolving epidemic and pandemic, and things are changing. We still need to keep our guards up and make sure that we are protecting not just ourselves, but the other people in the community.
So we have one last question. I'm also watching the clock. It's 10:01. We wanted to finish in 1 hour, and because we started a little late, so I'll go a few minutes later than the 10 o'clock hour. And it's related to the breastfeeding. The question is, if I'm breastfeeding, can I take the vaccine safely? And either Dr. Farnaz or Dr. Lubna, I know you're not an OB person, but it's still related to you.
I would be happy to answer that question, because this question is often asked by my patients' moms, and it's absolutely safe to take the vaccine when you are breastfeeding. As a matter of fact, just as antibodies are transferred to the child, you may be providing some protection to your child if you're breastfeeding and take the vaccine. So I highly, highly recommend it.
Thank you. Well, we may still have a little bit of room for another question, since that was a quick answer. And this again goes back to, so this Rosa Khan question is for Dr. So my mom often gets very bad headaches, and she recently got her first dose. How can you tell the headache is not from a blood clot? Thanks, Rosa, for the question.
So that's a very important question. If the first, as I see, if it's it says first dose. So if it's first dose, I suppose that it's either Moderna or Pfizer, which are 2-dose vaccines, and the risk there hasn't been any severe blood clots or that severe side effects that we've seen with Johnson and Johnson. If the headache is severe enough, that is different, very different from the previous ones that they had, they obviously need to contact their healthcare provider. But we haven't had these side effects with Pfizer or Moderna vaccine. So my answer is that just compare it with your previous headaches, and if it's severe enough, definitely you need to contact your healthcare provider.
Well, thank you, Dr. Farnaz. And I see there are no additional questions. What I'll do now here is just kind of summarize what we covered today. I think the take-home messages from our health panel tonight were that get the vaccine. They are safe by and large, despite some side effects. Most people actually really stay symptom-free. And it remains a very, very safe vaccine. It does prevent coronavirus. And get the first available vaccine that's you can get. The second piece is that mental health is a real issue, just like people have heart disease and high blood pressure and diabetes. Mental health is also a biological disease, and the depression and anxiety are real issues. If you see someone or someone in the community, if you find are talking about suicide or finishing their life, take it seriously and take mental health seriously and seek medical help as much as you can. And from a pediatrics perspective, definitely do take care of your kids. Do your baby checks or well baby checks, and it's still very safe to get and seek medical care. And hospitals, just like they say, airlines are really safe places to be. Just ask our doctors and healthcare providers; they will tell you hospitals are generally very safe places to be. In the end, I would like to thank our esteemed panelists again, Dr. Farnaz, Dr. Lubna, Dr. Noorani, and also all of you for joining. I know it's been a long day for all of you, and for you to finish your iftar and then do your iftari, and then you also have supplications and other du'as to do, and you were still able to join our program. I'd like to thank you again, and hopefully you found the program very helpful. So until next year, I'll say Assalamu alaikum and Khuda Hafiz.